Patellofemoral pain syndrome is a fancy way of saying that we have pain on the front of our knee, around and under our kneecap. Now, the thing that causes this pain is when our kneecap gets compressed to the front of our tibiofemoral joint. Tibiofemoral joint is just a fancy way of saying where our femur meets our tibia, i.e. where our upper leg meets our lower leg. When we get that compression across those joint surfaces and start to move through a range of motion, then we're going to get irritation under the kneecap. So, what causes the kneecap to become compressed on that joint? Well, 90% of the time, it's going to be our quad, okay? Our quad feeds into the kneecap, so if that quad starts to get tight, shortens up, it's going to pull that kneecap straight into the front of that joint and cause that pain. So, our mobility sequence to address that is going to use foam rolling and stretching to reintroduce some length and looseness to that quad, which in turn is going to pull that, or not even pull, release that patella, that kneecap off the front of that joint and relieve some of that irritation that we're getting from compression. Loosening up our quad is going to start with some targeted pressure release using our ulti-roller. So what that's going to look like is we'll be on the ground, we're going to have one leg extended, we're going to lie on our stomach. To start, the quad, or the roller rather, will be right below the pointy part of our hip, and we're just going to find the right place, i.e. the knotted up tissue within that quad. So I'm going to slowly roll through that quad, wherever it's a little bit more sensitive, like right there, a little bit more tender than the rest of my quad. That's going to be where I stop and hang out. Now, our quad tends to be a little bit more sensitive than other musculature, so you're really going to have the propensity to, once we hit that tender spot, to really brace up against it and kind of get knotted up in ourselves. So let's make sure we're breathing, we're relaxed, that we're not fighting against this pressure, that we're just letting it dissipate into the muscle. And then finally, once we have that relaxation, we can go through our contract relax. In this foam rolling, the way we're going to contract our quad is by extending our knee, making sure our quad is nice and rigid. We'll hold that for 5 seconds, 5, 4, 3, 2, 1, and then we will relax and let that pressure dissipate once again into that tissue. After 30 seconds, we can go back into our 5-second contract, squeeze the quad, 5, 4, 3, 2, 1, 30-second relax. And per the rules of the Ultimobe system, let's get at least 3 of those cycles, and then we can either continue on that same trigger point, or we can move on to the next, go a little bit farther down our quad and find where else we are sensitive. Now, once we get an adequate amount of work on that, 3 to 5 minutes, then we can go into a stretch, which is going to add further flexibility, further looseness, give some slack to that quad so that our patella, our kneecap, isn't being pulled up against that knee too much. So the stretch we're going to use is a couch stretch. Let me say right off the bat, this might be the most intense stretch we do. The other side of it is, it also might be one of the most effective stretches we do. So please, even though it's a little uncomfortable, give it as much time and as big of a try as you can. I promise your body's going to thank you for it. So what this couch stretch is going to look like is we're going to start by getting our knee as close to a wall as possible. I highly recommend having something padded under your knee, because guess what? Your kneecap on a solid surface is not going to feel good here. So we're going to get our knee close to the wall. We're going to have our foot, our toe pointed up towards the ceiling, and then finally our opposite leg, we're going to bring that up to 90 degrees. Okay? Immediately in this position, you're going to feel a stretch. So there's 2 ways that we can approach this. If just being in this position is a little bit too intense, we can put our hands on the ground, which kind of puts a little bit of slack into that quad, makes it a little less demanding. Or if we're flexible enough and we can handle it, we're going to come up top and we can use our ulti roller to support us in this position. Now, once I'm at my end range, which is simply as far up as I can get, and then second, as far forward as I can drive my hip, then we are going to relax. Once again, this is an intense stretch, so please, please, please take a couple seconds to breathe, make sure we're not tensing too much through that hip, and just that we're in a relaxed state as we go into our cycles. So, once we're relaxed, we'll go through our contract relax cycles. Okay, for the 5-second contract, the way we're going to do that is by pushing our foot into the wall. As always, it's going to be static, so I'm pushing my foot in the wall, nothing moves, but I have a contraction on this quad. I'll hold that 5, 4, 3, 2, 1, and then we have our 30 seconds of trying to relax further into the stretch, which is going to look like trying to drive that hip a little bit farther forward. After 30 seconds of relaxing into the stretch further, then we'll go back into our contract, push our foot into the wall, 5, 4, 3, 2, 1. 30-second relax after that. And per the rules of the Ultimum system, we will get at least 3 cycles of that. Once again, this is a fantastic stretch. It really helps with knee function. It helps create some slack in that patella. So if you can spend more time in that stretch, you can get more cycles, please, please do. Spend 15 minutes a day, a couple of days in a row with this patellofemoral mobility sequence. See how it makes your body feel. Let us know, and if you have any questions, please, please, please send them my way.